Namaskar दोस्तों, welcome to channel Toxicology on board. In this video, we'll be discussing with another topic, DABT topic, phenol toxicity. So this question, unlike my previous video, this is not taken from the ABT 50 series of text question, but this question I found across in ABT manual and presentation slides for the SOT Society of Toxicology 2019. So ABT manual presentation slides ka you have one brochure is there. In that 2019 manual, they have given this type of exam question format. Okay, so from this only I have made this video. This particular question is dedicated taken from this particular 2019 SOT brochure. Okay, let's see what is the question is. The question is is what is the major life-threatening effect following the poisoning with phenol? So you can see that in the case of either Clayson textbook, if you see, if you look into ABT, DABT syllabus also, solvent toxicology is one of the important chapter is there. In that you have to learn about various types of solvents like ethanol, methanol, isopropyl alcohol, rubbing alcohol is there, benzene is there. Okay, some other ether or polyethylene glycol, some other vehicles and solvents are there which are commonly used in the pharmaceutical industry or in other type of agrochemical industry or pesticide industry. So their solvents, how those solvents are affecting the workers who are working with these solvents and the scientists as well as the people who are getting the end user. Certain times these solvents are used as a vehicle in the medicament preparation or in the cosmetic preparation also. Excessive exposure to these solvents will also cause some toxicity, particularly they are affecting the CNS. Okay, so those type of topics you have to read, but this particular video is example in this particular case study is with respect to phenol as a solvent. So what is the major life threatening effect? So you need to identify the solvent and the type of adverse effects or severe toxic effects it is causing. There are some also some classical diseases and examples are there. Those diseases also you have to remember and you have to link it to the particular solvent which is responsible for the causing that particular disease. Okay, so in case of phenol, let's see what are the options which are given. So same questions I have just same question here from the screenshot I have kept over here. So the first option what they have given is optic neuritis with permanent blindness. Okay, so there is a here it is affecting your eyes and it is causing permanent blindness. You have to identify the solvent. As far as I remember, methanol is the one which will form a toxic metabolite. I'm not remembering. Maybe it is formic acid or some methanol next metabolite is there activated, which will cause permanent blindness. I'm hoping phenol is not the right answer. You have to also understand for this question there is no answer given by this in the brochure. So you people, after going through the yourself to the literature, you identify. I'm just listing out of the options, okay? And I'm also trying to explain the options why it may or may not be. So option two was severe gastrointestinal irritation. So any chemical which is having corrosive nature, they will affect the intestinal lining. Okay. So here it is GI irritation. It is saying. Third option is esophageal stricture. This is the esophageal will be there no pairing then esophageal that particular stricture in stomach esophageal stricture will be there no that it is affecting. Number four is fatty degeneration of the liver. Generally maybe fatty generation is ethanol related toxicity should be there. So mostly answer will be either B or C. B and C again they are closely related, because if this particular phenol if it is accidentally consumed no, it will, because of it is corrosive nature no, it will definitely cause irritation. Esophageal stricture, I am not remembering which solvent is responsible for that particular thing. So you go back and identify the right answer. In this video, I will be not giving the right answer. So this phenol poisoning is also commonly known as carbolic acid poisoning, and this is a typical chemical formula C6H4OH. Okay, benzene may they are adding hydroxyl group OH group. Okay, so these are the in whenever you are reading solvents, also read about this GHS and CLP classification. Some labeling structure, some pictograms will be there. That also you try to remember. In this case, it is causing the aquatic toxicity, corrosive, all these properties are given. So simultaneously also read GHS as per US as well as CLP as per EU. This classification, labeling and packaging with respect to chemicals you read. So let's directly dive into the whatever the literature I could identify. I am telling you. See, I have given the reference page number 279 or 1217 of 1639, Classon's ninth edition. I am saying. So please go back and refer 12179, 1217. This picture is taken from that, and 279. This is the picture. So this is the you can see in figure. So there is a phenol. Phenol undergoing metabolism, okay, undergoing hydroxylation, and it is forming hydroxyquinone. Then there are two OH groups are formed attached, okay, and here also catechol is forming after hydroxylation based on the position of OH group, whether it is attaching on the ortho position, meta position, or para position. Different metabolites are formed. So see, initially phenol is having only one OH group, but catechol is having two group. Although and meta position binding is there, this OH no undergoes oxidation and it is forming ketone group. So hydroxyquinone is formed. So like this, all this para hydroxyquinone based on the position, although meta para, since the ketone group is on the para position, it is called para hydroxyquinone. So try to read this one and how the epoxide rings are formed. Please read page 279 in detail. Then also we are going through page 1217. Here we are seeing the role of cytochrome P450 and peroxides in the activation of benzene to myelotoxic metabolites. Why benzene means, see, as I said, no, phenol, if you see, this is the structure of the phenol. Phenol, the structure is similar to that of benzene, but additionally what we have, this OH hydroxyl group is there on the or the on the first position. Okay, so once the benzene is metabolized by the enzyme CYP450 in the liver, again you have to remember where this particular solvent is getting metabolized. The type of the metabolites which are formed in the liver are different than which are formed in the bone marrow. So let's try to understand. So we are also reading along with the phenol benzene also. Benzene is there. Benzene, once it entered into the liver, it is acted out upon by CYP450 enzymes. We have a series of CYP enzymes are there. 3A, 3,4, all those are there. Classification, full family of CYP enzyme is there. In that only 450 is the one which is acting on benzene, based on which phenol is formed. OH undergoes oxidation and a hydroxyl group is attached. So again this phenol will acted upon by the CYP450 enzyme and you are forming hydroxyquinone. So ortho meta para position, another OH group is there. See here, same this hydroxyquinone. This hydroxyquinone, once it enters into the bone marrow, the bone marrow will be there, no, once it enters into the bone marrow, it undergoes stimulation, that is PHS myeloperoxidase enzyme is the one which acts upon it, and it is there is a electron transfer, all those things, de-electronization is taking place, and there is a phenoxy radical is formed, highly reactive phenoxy radical is formed. It's an unstable molecule, okay, it is a negative charge molecule. What it will do, it will go and bind with the protein and DNA labeling to, and it will cause bone marrow suppression. This is how the benzene is causing bone marrow toxicity, or it is causing bone cancer. So you have to remember the mechanism. Benzene, metabolite phenol, phenol is forming hydroxyquinone. So one question might they ask you what are the enzymes, 6450 you have to remember, and you have to remember the location also, whether it is affecting the liver, there it is metabolite is forming, and where the bone marrow, what kind of metabolite is. Always also remember that whenever there is a free radical formation is there, here you see O dot is a free radical. One electron is loosely there, but means it is highly reactive. It can go directly bind to the DNA as well as the protein which is there in our bone marrow. Okay, so let's very quickly go through what are the important the routes of administration, how the phenol is affecting based on the route of administration. So as I said in the first picture, carbolic poisoning, phenol poisoning is also known as carbolism. So one question they will give you with respect to carbolism, then you have to identify the solvent. So like that only, solvent syndrome, some diseases I told, they will ask you to identify the type of the solvent. So in the case of phenol poisoning or carbolism, it is an acute medical emergency. There is no chronic exposure. There is a immediate exposure is there, resulting from all three routes: ingestion, inhalation, as well as absorption. So there is dermal exposure, inhalation exposure, and oral exposure. Phenol through the skin, right? So what are the things, if it is exposed through dermal route, what are the adverse effects that we come across with respect to phenol is the signs and symptoms of phenol poisoning depend on the route of exposure, correct? Okay, phenol is rapidly absorbed through the skin layer, okay, and can cause severe life-threatening burns. So as I told you, it is caustic action, similarly like that of sodium hydroxide, no, it is having caustic action. Here, white patches will be formed on your skin where the exposed through phenol. Initially, it may cause a painless white patch on the skin due to its anesthetic properties. So phenol have one of the important property it is having, anesthetic property it is having. Then the affected area later turns red brown before the dead tissue eschar. So there is a various stages are there. White patches forming, then the skin is becoming red, then it is becoming brown, then it is the skin is completely dead, and the peeling, like uppermost layer, it sloughs off, it comes off. Eschar reaction will be there, and it fall of that particular layer of the skin takes place. Systemic toxicity can quickly follow because since the uppermost layer, skin layer has been disrupted, compromised, now the particular phenol, it can go penetrate through these various layers of the skin and reach the systemic circulation, can quickly follow causing muscle weakness, right? Here you cannot do the muscle weakness, tremors, loss of coordination, and shock. So these are all caused by dermal exposure. Okay, so let's see what happens when phenol is exposed through oral route. Even small amounts of phenol can be fatal, even the smallest quantity. So it's an assignment to you, go back and check what is the dose of the phenol which is causing fatality, what is the oral dose, what is the oral dose, what is the dermal dose, what is the inhalation dose. That is an assignment to you people. Initial symptoms are a hot burning pain in the mouth, okay, throat, as well as in the stomach. Okay, let now when we are reading this, no, you have to go back and see the answer if one of our options, either B or C, comes and falls into this particular option. Then next one is corrosive damage. As I said, no, because the lips, the mouth, as well as tongue may become white and hardened. Here the tongue will become white and it becomes hardened, solidified. There is muscle, there is no movement, as we have seen here, no, muscle weakness will be there. Then next, what are the systemic effects after oral exposure is it can lead to internal bleeding. So once it enters the GI or stomach, it will start causing internal bleeding. See, we have to understand, if there is an external bleeding, you can identify. If there is an internal bleeding, you cannot identify until unless you do some kind of MRI assay, or some assays will be, some test will be there based on that. Vomiting, diarrhea, a sharp drop in blood pressure, so hypertension, then hypotension, MNC, collapse, coma, and death. So these are the various stages, okay, right, starting from internal bleeding till death. So what is happening when phenol is exposed to inhalation exposure? Let's very quickly go through. Breathing in phenol vapor can cause respiratory distress. Most of the solvents, no, when the workers are exposed, no, they will undergo respiratory distress. For example, formaldehyde, formalin also, excessive exposure will cause the same thing, respiratory. So there is a breathing difficulty. Okay, respiratory irritation causes a sore throat, headache, shortness of breath, irritation of the respiratory tract. Okay, there is uneasy during your breathing, and severe cases may lead to buildup of the fluid in the lungs. So pulmonary edema will take place in your lungs. Fluid accumulation will takes place, because of which you will be having a difficulty in breathing, and it eventually might cause to a death also, or you might need a intubation in order to aspirate. What is artificial respiration is needed for example, in terms of intubation will be needed to keep the person still breathing state. So that was the important things that we have learned. So this question was not taken from this was taken from the SOT brochure, which was given by the DABT only. And in this case, in this video, you have learned about the solvents. In that particularly case study, we have learned about phenol, its mechanism, metabolism, benzene from its metabolite phenol is forming hydroxylation, how CYP450 enzyme plays a key role, and the same solvent, how the different metabolites are formed in the bone marrow as well as in the liver. Okay, and the oxidative state, free radical state is how they are highly reactive and how they are reacting with your DNA as well as protein to form some edX or some toxic metabolites. Okay, and we have also learned about the different types of exposure, how they are affecting the toxicity. So in future videos we'll discuss about more solvents. Actually, I have already discussed about the ethanol solvents. I have discussed in my initial videos. You can go back how the ethanol, methanol, isopropyl alcohol, rubbing alcohol, all these things I have discussed. Kerosene also I have one case I have discussed in one of my videos. You can go back and check. So for thank you so much, and be curious. For any questions, please you can write a mail to arya.priyanka18@gmail.com. As you can also like, subscribe, and follow my YouTube channel Toxicology on Board. Thank you so much. All the best for your exam.